Immunology is the branch of medicine and biology concerned with immunity. Just a little small background or history about immunology. In ancient history, people have tried many different ways to come up with a way to treat disease. Um, the first, the very first recorded attempt to induce immunity was performed by the Chinese and the Turks. They were the first to they were the first recorded to attempt this. They attempted to prevent smallpox, and a guy by the name of Edward Jenner developed a technique, probably, I think, maybe around the 1970s or something like that. Around that time, don't quote me if I'm wrong. He developed a technique of inoculating cowpox to prevent smallpox, and he did this on a little boy. He inoculated the little boy with cowpox in hopes that this would prevent smallpox. And then later after that, Louis Pasteur, he was able to vaccinate sheep and other animals with anthrax, which was a very good discovery. He vaccinated sheep and many different other animals with the anthrax virus. Technology has made some advances in the study of immunology since then. Technology has definitely expanded since the ancient times, ancient history. We have things nowadays that they didn't even have back then, didn't even think about having. So I found this article that I thought to me was pretty interesting because it's a pretty big subject. It's titled "Antiviral Immunotherapy Comes of Age." And actually, this article was recently published this month by a guy named Lucas Lawson. He basically suggested that T cell therapies are not just for cancer. T cell therapy have been successful in treating cancer, but they also have advanced it basically to treat viral infections. Most research on antiviral T cells has focused on people undergoing bone marrow transplants for blood cancers such as like leukemia, things like that. Right now, only a handful of donors donate T cells as an antiviral therapy to bone marrow transplant patients who are very vulnerable to infections from common viruses. So these bone marrow transplant patients who are receiving transplants, their immune system is subject to infections, like everyday common viruses that you can get, and they're basically trying to find a way to prevent that. Researchers are also advancing immunotherapy methods to protect bone marrow transplant patients from viral infections, as I've already said. So they're trying to protect these patients from these viral infections. It resets the recipient's immune system, which makes them more vulnerable to common viruses. Immunotherapy adapts the immune cells to destroy specific cellular targets. Researchers can expand this research by recruiting a large number of bone marrow donors. So as I've already said, right now only a handful of donors donate T cells, and according to this article, almost 50,000 people a year receive blood producing stem cell transplants. That's a lot. 50,000 people receive these transplants a year. So I think that if they could recruit more people to donate these T cells, then they could advance this idea of preventing common viruses and of these for these people who are receiving these transplants. Um, the relevance of immunology can span from pregnancy to senescence and from vaccination to cancer, a wide different range of things. Immunology has been successful for the discoveries of the mechanisms of resistance to HIV infection, also for interaction of genes and environment in allergy, and antigen recognition by T cells, and many other subjects. So it's been successful in discovering mechanisms for these subjects, and I believe that it's only gonna expand. It's gonna get better. Immunology research is shaping up to give rise to clinical applications in the next decade or so. So they're saying basically that in the next 10 years or so that this research can give rise to many things that we don't have answers to, and I really hope that we can one day find a cure, find the answer to cancer, to help cure cancer. That would be really big. I feel like it would give more recognition and insight to what immunology is and what it can do, because not a lot of people really know the or study immunology, but it's relatively new, and it's important in our medical field right now. Although there is still an innumerous amount of work to be done, I can only hope that they will soon find answers to these harmful infections and diseases, as I've said already.